Thyroid labs, and what do you need to know about all of the numbers and what to be asking for when you go get a thyroid evaluation. Hi, I'm Dr. John Hargrove at the Holistic Health Center in Savannah, Georgia, and also lead physician at peptideyourway.com. First of all, TSH, you all have heard of that one. Every doc runs that one. It's the thyroid stimulating hormone. It's the measurement of your anterior pituitary telling your thyroid what to do, how to make that hormone, how much to make. That's TSH. Most docs run that. A lot of times that's all they run, and if that's okay, they don't look any further. T4 is next. That's the amount of thyroid hormone made in the thyroid gland itself. TSH tells your thyroid gland to make T4, and that measurement tells you what amount of T4 is being made and released into your bloodstream. That is not the active form though. T3 is the active form predominantly. T3 is formed from T4 in what's called conjugation. Conjugation happens in two areas, the liver and then also, surprisingly, the gut lining. So people that have issues with inflammation, sensitivity, gut irritation, IBS, those people a lot of times have a low T3. And T3 is the active form again, so you want to know that number. T3 is what actually is able to bind at the cells. That brings us to the next number that you should be looking at. A lot of docs don't do this test. T3 uptake, that's the measurement of the actual active form binding at its receptor sites. It's an easy one to check, it's inexpensive. TSH could be fine, T4 could be fine, T3 could be fine, your conversion could be happening, but if it doesn't bind at the cells and get taken up, then you don't have the effects of your thyroid hormone. So the next thing to be looking at is the autoimmune markers, TPO and Thyroglobulin. These tests are important when somebody is told, hey, your labs are normal, your T3 or your TSH is normal and your T4 is normal, and that's all they look at, but you still have thinning hair, you have dry skin, cold hands, feet, your metabolism is slow, your energy is slow, your sleep is poor. These things all indicate low thyroid function, and years before your TSH and T4 can go off track, you might want to look at TPO and Thyroglobulin. These are the markers that determine if you have an autoimmune disease. So those are the markers that you should be talking to your doc about. Again, we're always available for consultations here at Holistic Health Center and peptideyourway.com. All right, we'll talk to you soon.